Hello and welcome to the third module on point-of-care ultrasound at Legacy Health. I'm Dr. Gordon Johnson, the Medical Director of POCUS here. And in this lecture, you'll see graphics that are used with permission from the textbook from Neelam Soni called Point-of-Care Ultrasound. First, we're just going to introduce you to imaging the liver, then the spleen, and then we'll talk about the three-point abdominal fluid assessment. We are not going to go into more advanced studies. These will be investigated in other modules such as the aorta, gallbladder, appendix, small bowel, renal, bladder, etc. So first with abdominal fluid assessment, there's a binary question, and I feel that every clinician should be skilled in this. It's very easy to do. And the question is, in a distended abdomen, is there fluid or ascites present? And I refer to this as the bunny hill of POCUS. It's very easy, as I said. So when you're looking at an abdomen like this, the physical exam is basically a coin toss with fluid wave and shifting dullness. But if you look with POCUS, you'll likely find something like this, which is just gas that's scattering the sound from the ultrasound. But you may also find this, which is a big pocket of fluid, indicating that there is ascites. The other question you can answer is, when you do find a pocket, is it an adequate amount to tap or not? And this you can see on the side with the hashtag markers. This is about 7 centimeters deep and would be very safe to tap with someone with the skill to do paracentesis. So again, just another look. The black is the fluid or the ascites, and the bowels you can see here looped with the mesentery. So when we're doing the basic abdomen, this is how you want to position the patient, lying flat, and then I usually ask them to raise their arms like they're lying on the beach sunning themselves. And this exposes the three areas that we're going to look at to do a fluid assessment. So here are those three areas. First, the right upper quadrant, number 1. Number 2 is the left upper quadrant, the spleen. Number 3 is the fluid around the bladder. So where I usually like to start is looking at the liver. This is the largest organ in the abdomen, and when someone's obese, some of them can be a little bit difficult to find, but if you find the liver, this can be a good landmark of where to look further. And then we want you to hold the probe in this kind of knuckles to the bed scoop fashion here, and you can easily just slide down once you have identified the liver down to the kidney. Now, there is an exam you might have heard of called the FAST exam, or the focused abdominal ultrasound in trauma, looking for fluid. In medicine, we do the same exam, basically. The cause of fluid, though, usually isn't intra-abdominal bleeding. It's often ascites from heart failure or cirrhosis or other causes. And here you can see a small little strip of fluid in the hepatorenal space, or Morrison's pouch. And this is where we look for that. Now, you need to be careful when you do these studies. You can easily mistake that you didn't get an adequate view of the kidney, and you need to look down to the inferior pole, because the most sensitive place to see the fluid is actually near the caudal tip of the liver, in between the kidney and the liver. There is seen in the picture towards the right. So the next place to look is in the left upper quadrant. And here you're going to first try to identify the spleen. So again, you want to make sure your knuckles are to the bed. So you're looking at a retroperitoneal organ here. So move down till you can feel that bed and try to identify the spleen. And here you'll see the spleen pictured and actually measured out at 15 centimeters. And again, you can see the splenorenal space there. But what's important about the spleen is you can often see the ascites above the spleen, in between the diaphragm and the spleen. So you want to make sure to look there as well as the splenorenal space. Again, here you can see the diaphragm, the ascites, the spleen, and then the kidney down in the lower right. Now, you do have to be careful sometimes, because you can see the gut. If someone has fluid or food in their stomach, you can mistake this for fluid, but here you can see the gas bubbles moving around. That's clearly just fluid in the stomach. Here near the caudal tip of the liver, you can see fluid in the antrum of the stomach as well. Now next we'll be looking down by the bladder. And again, there's a separate module on bladder ultrasound. But here we're looking for the fluid in the male. It's between the rectum and the bladder. In the female, it can be in the pouch of Douglas between the uterus and the rectum, or between the uterus and the bladder. It's important to look at both of these places. Here's how you place the probe in a transverse positioning and then fan it down so you're looking down into the pelvis. And these are the views that you're looking at on the female and male pelvis respectively. And here's a closer view here of a male with ascites just down on the right side, just below the bladder. Now, the other thing to be aware of is just the normal colon and other bowel. When you're looking in the abdomen, can often look like this. Many times it's not so clear, it's just sound that's scattered from the gas within the colon or the small bowel. Other caveats to look for is cases like this, where you can see there is fluid in the abdomen, but if you look at the picture on the left there, you'll see that there's actually stool in there, and that stool mixed with fluid inside the small bowel with a small bowel obstruction. And then the picture on the right is also a small bowel obstruction, only has a little bit of ascites here, probably not safe to tap. There's only 1 centimeter of fluid there, and it's unlikely to give you the cause of the diagnosis. The diagnosis is probably more related to what's causing their small bowel obstruction. So when you're wondering if a person has peritonitis, again, the abdominal ultrasound is a great place to start. You might see something like this, where you see this kind of jagged edge of the liver. It's kind of knobby and hyperechoic, indicating that there's cirrhosis present. But you may see something like this, and here you see a nice homogeneous liver with a nice sharp tip to the liver there. And if you look closely, you can see a little fibrinous strands there between the liver and the bowel. And that was actually a case of TB peritonitis, but clearly not cirrhosis as the cause of their ascites, just by looking at the liver there. Now here's another case. I've had this happen a couple times. I was asked to do a therapeutic paracentesis for a patient, and I saw this kind of a picture. And again, there's just a lot of fibrinous strands in here, just a spider web mass of badness. This patient actually passed, I think, within 24 hours. They had rip-roaring peritonitis. And then here's another example of something to look at, why this case in particular is a surgical emergency, just to look closely there. If you see now, you'll see as we go up a little bit, there's a little bit of free air causing these A lines in the abdomen that come up into this portion here. So you position the patient up and see if this air goes above the liver. If it does, it's usually free air in the abdomen, and that's obviously a surgical emergency unless they've just had a laparoscopic surgery or something. So that's the end of the basic abdomen. Again, there'll be further modules on more complicated abdominal features. Thank you.